Hey everyone, my name is Jeffrey Samuel. I serve as the Regional Director for Africa at Direct Relief. And this is truly an honor and a privilege to get to share today on this panel about our earthquake response in Morocco. Let's get started. On September 8th, a devastating 6.8 magnitude earthquake hit Morocco just after 11 p.m. local time. So the epicenter of this earthquake was about 44 miles southwest of Marrakesh, right in the middle of the high Atlas Mountains. There are tons of little villages in the mountains. What you have to understand is that this area is extremely isolated. It's very rural and relatively poor and under-resourced. So prior to the earthquake, you would hear stories of people having to travel several, maybe 1 to 2 hours to be able to go see a doctor, and many of the buildings in this region are built up with mud bricks and are not designed to be able to withstand the shaking from an earthquake. So the health infrastructure was already poor. Now all of that has been made much worse by the earthquake, which damaged a lot of those facilities, cut off the roads, and made it hard for people to be able to reach care. Because of these factors, it's estimated that at least 500,000 people were displaced, 5,600 people were injured, and almost 3,000 people died. Almost half of those deaths occurred at the epicenter. So prior to the earthquake, Direct Relief had supported Morocco in a number of different ways since 2014, which included a rare disease program in partnership with the Ministry of Health and a local NGO. And those pre-existing relationships really gave us a pathway into Morocco after the earthquake. So as many in this audience are probably well aware, most of the international humanitarian community was waiting for Morocco to make a request for international assistance, but that request never ended up coming. So our focus from the very beginning was to be able to commit cash support for the search and rescue phase, because you really have maybe 3 or 4 days to be able to save people's lives that are still trapped underneath the rubble. So Direct Relief provided an emergency operating grant of $100,000 to deploy a 14-person search and rescue team from Spain. And this was one of the very few groups that were initially approved by the government. In addition to the grant, we were able to pretty quickly receive a local donation of nutritional products from Abbott Morocco. So huge shout out to Abbott for making this opportunity available to us. And we were able to support a group called the High Atlas Foundation. This group was holding earthquake relief camps for all of the people that were displaced. And we were able to donate 20,000 units of Ensure that was distributed alongside food and clean water and tents within these camps. One of the things we always try to consider during our emergency response efforts is, which patient populations are most vulnerable after a disaster. And some of the most at-risk groups include children, pregnant women, and new mothers. So knowing this, we reached out to a longtime partner of ours, the International Confederation of Midwives, and they were able to connect us to the local Moroccan chapter. And we ended up providing a $75,000 grant to support their midwives by number one, providing preparedness and recovery training for the midwives themselves, and number two, so the midwives could launch a health caravan to conduct outreach within the Atlas Mountains. And these midwives were able to provide sexual and reproductive health care as well as psychological support for the women. So this was essentially a clinic on wheels. But after some time, despite the fact that there was never a declaration for request for outside support, we were able to get approval to get supplies into the country. So one of the groups that we worked with, the Association Amal Salah, supported health clinics in the mountainous communities with medical material aid that contained items such as our emergency medical backpacks, wound care supplies, antibiotics, and IV fluids, among several other things. We also supported another group called the People to People Aid that equipped first responders and healthcare workers to do outreach among the displaced community. In regards to our ongoing recovery efforts, we're now focusing our attention on health infrastructure projects. In particular, we really want to help restore community health centers within the High Atlas community, as many of these health facilities were destroyed because of the earthquake. And without, these small community health centers, the people have to travel hours in order to be able to go see a doctor and to get the primary healthcare services they need. And these centers are really a lifeline for many of the smaller communities, and that's no different than how it is in the U.S. as well. Community health centers are the backbone of safety net, primary and preventative healthcare services for underserved communities. Another area where direct relief is really starting to increase our focus on organizationally is with resilient power. Because without power, critical health services can't be provided. Life-saving medicines go bad, electronic health records can't be accessed, and essential medical equipment can't be powered, and vital community health facilities serving the most vulnerable end up shutting down. So we started an initiative called Power for Health that addresses this health disparity and the need for renewable energy and community resilience. See, and in Morocco, grid power in the high Atlas Mountains is expensive and unreliable, and most health centers do not have access to backup diesel generators. And for those that do, diesel is extremely expensive and not necessarily the best for the environment. Now, I don't know if you've been to Morocco before or not, but Morocco enjoys relatively sunny climate. So Direct Relief is looking to equip up to 40 different health centers with solar and backup power in the region. And lastly, we're coordinating with a local health ministry on a health infrastructure project through a public-private partnership that ensures that this project will be maintained and supported well beyond our recovery efforts in Morocco. So for those that aren't familiar with Direct Relief, our mission is to be able to improve the health and lives of people affected by poverty or emergencies, and we're active in over 100 countries. But that said, Morocco was a little bit of a different case in regards to our emergency medical response. Compared to other recent disasters or conflicts, like in Ukraine, where we've sent over $1.1 billion worth of material medical aid, or Turkey, Syria, Gaza, as you can see on the screen right here, our response in Morocco looked much different in terms of the size and volume. But many of the same principles we apply to other disasters is what we applied to Morocco. So some of the key takeaways that we had were, number one, the need for collaboration. One of our guiding principles at Direct Relief is to identify and support locally run healthcare partner facilities by providing access to essential medications and supplies. So we have over 2,000 partners in our network. And so when disasters like this, earthquakes strike, we've learned to really lean into our partners and networks extensively. So as I mentioned earlier, our partner in Morocco helped us to be able to identify unmet needs on the ground. We also have learned the importance of working closely with international associations, such as the Society for Critical Care in Medicine. We've worked with the International Society of Nephrology, the International Confederation of Midwives, and several others. And each of these networks have a web of connections and relationships that have been tremendously helpful in our emergency response efforts. For me personally, one of my primary roles at Direct Relief has been to coordinate directly with ministries of health, and I've really learned the importance of aligning our strategy and programs along with MOH priorities. We've also learned through our work with many of the companies that are present on this call, the importance of mobilizing philanthropic health resources while also maximizing the efficiency of existing resources. That might look like financially to support search and rescue efforts, or long-term infrastructure and recovery projects, or building out cold chain capacity that will help strengthen fragile health systems and increase access to quality healthcare. It also could mean, utilizing those funds to help restore the medical supply chain as quickly as possible, which is critical, and that can't be done. And that can be done through the provision of donated medications and medical supplies. And then also figuring out ways to get those supplies into areas where the roads might be broken down, but the needs are still extensive, as was the case in Morocco. And then longer term, we want to continually support our partners on the ground even after the acute phase is over. So another lesson is supporting health infrastructure projects that were damaged or lost, but building it back in a way that's sustainable through public-private partnerships, and also resilient for future earthquakes. This was one of the largest earthquakes that Morocco has ever been hit by, but it's not the first. So we always want to think through, how do we build back better? So thank you to all of the companies, the foundations, and the people that provided material and financial support for our earthquake response in Morocco. And a special thank you to PQMD for creating amazing platforms like this to be able to share and learn from each other. Thank you. So in regards to best practices for identifying partners at Direct Relief, we really try to make sure it's the right fit. We evaluate what the needs of the partners are, and then our ability to be able to support and address those needs. We also evaluate a partner's ability and capacity to receive medical material aid if it's for a donation. If it's for financial support, then we want to make sure that there's alignment with our mission and values, there's transparency, and a demonstrated ability to deliver impactful healthcare interventions. And as previously mentioned, we leverage our existing networks and referrals and try to establish collaborative relationships with organizations committed to improving health outcomes for underserved populations. In regards to risk tolerance decided for funding decisions, at Direct Relief, risk tolerance involves a balancing act of providing timely assistance with the need to mitigate financial and operational risks. So decisions are made collaboratively, drawing on expertise from various stakeholders and guided by our Direct Relief's mission to provide effective medical material aid to those in need, while also ensuring responsible stewardship of those resources. So we factor in lots of different things such as the severity of the emergency, potential impact on affected populations, and then finally our capacity and ability to manage those associated risks.